Hi winners, hope you're doing good. So in this video, we'll be discussing about few important strategies, their examples. So in the last live, we have discussed about this TGP. Okay, if you're not clear, you can go back and check the last live session. And as already mentioned, T is nothing but the amount of time that is left over for you in the form of number of hours you are preparing, in the form of number of days you are planning to prep, whether with internship, without internship. So it varies. Okay. So make sure you're clear about how much time you're planning to prep in number of hours rather than number of days. The second one is what is your goal? So goals varies basing upon the situation. Goals varies basing upon the capability, financial limitation, reservations, categories, state from which you are, and what seat you are planning, whether it's an A category or a B category or a C category or a government seat or a central government seat or a deemed college seat. It varies from individual. Then execute the plan. So here in this particular video, I'll be discussing about one plan. Okay, so as per the request of most of you, so I'm discussing one of the plan. So before you start the plan, make sure you're very clear about what is your T and what is your G. Okay, so now overall subjects, what are the main subjects and everything according to the blueprint we have discussed in the last class, but these are the overall subjects that you should not miss. Even I have added the minor subjects also, so that you will not miss at any point of view, because I see students preparing for entrance seriously going back, coming back from the examination telling that, sir, forget to revise forensic odontology, forget to revise embryology, questions came from embryo, so I forgot to revise the embryology, because most of us have a focus on the major subjects. Like no one is going to go to an examination without preparing for an endo, or no one is going to go and attend an exam without preparing for general anatomy. But we have a habit of skipping this embryology, histology parts when compared to general anatomy part. The problem here is things were not organized for most of us. We rely on few sources or we rely on few books, and these books will not differentiate these subjects as a separate subjects, but these subjects questions are going to come in the examination hall for sure. Okay, so keeping that in mind, I tried my best to segregate almost all the subjects, even a minor subject which will take half an hour to prepare, but there is a chance that the question will come from this minor subject. So I listed out all the subjects like that. So first starts with our anatomy plus embryo and histology, biochemistry, physiology, dental anatomy, dental histology. I want you to focus on oral embryology too, which is nothing but development of face, development of cheek, development of lip, development of tongue, application part of all of these things, particularly cleft lip, cleft palate. Okay, all those are going to come under oral embryology. Okay, basic embryology part. Then comes dental materials. Then comes pharmacology. Very specifically, I want you to focus on anesthesia part. Okay, so particularly local anesthesia, general anesthesia. I want to segregate LA as a different subject, LG as a different subject. You cannot go to exam without revising these things. Again, microbiology. Very specifically, if you ask me, oral microbiology, general path, general medicine, general surgery, oral path, oral medicine, and forensic odontology. So don't miss forensic odontology. Oral radiology, pedo, and preventive. Preventive dentistry is also very important from the examination point of view. Ortho, cons, endo, community, and we need to read community from medical aspect also. That I have marked it as SPM. Prostho and implantology. Okay, implants are very important. Oral surgery. Apart from this, I told you these are the 20 main subjects which I have listed out, and followed by I have segregated it separate. Implantology is the 21st subject. Medicine, normally oral path, oral medicine we read together. I want to segregate medicine as a separate subject. I want you to focus more on histopathological features. Don't miss histopathological features. 22. 23 is forensic odontology. 24 is anesthesia. 25 is oral embryology, but most of your oral embryology is integrated with general embryo. So I listed out different, but you can read together. So that is 25, 26. 27 is general histo. So 27 is your general histology. Then comes 28 LA. You can read with GA, no issues. and 29 is medical emergencies and medical considerations, drug interactions, and all those things which happens in and around dentistry. Okay, all your medical emergency, your ward related, your emergency protocols, basic life support, all these are going to come under medical emergencies and medical considerations. Of course, it is mandatory that you have to read COVID properly, mucormycosis properly, because these are latest things which we regularly don't stress much. Okay, but you see latest question papers, most of the questions are moving around COVID, most of the questions are moving around mucormycosis, very common diseases like syphilis, TB, herpes, HIV, hepatitis. So all these are very, very important from medical considerations as well as the medical emergencies. What happens on a dental chair is a very common and a genuine question which is very frequently repeated in the examination. So this is an overall glance. The main motto why I have listed out the overall subjects is whenever you are preparing for an entrance exam or whenever you want to rebounce in the entrance exam, restart in the entrance exam, or whenever you want to take a overload, like for example, you're having 2 running subjects and you want to take an extra subject, okay, in handling the backlogs, in handling the revision or anything, you need to pick up a subject which is easy and comfortable. For example, now the running schedule of MDS CONQUER is moving around pharma and microbiology. Okay, and trust me, pharma, microbiology are commonly tough subjects. Okay, they are tough subjects because we don't have a proper exposure to these subjects at a UG level in majority of the colleges. So now you have a tough subject in front of you. So it is a very simple common sense. Whenever you want to add a load, whenever you want to revise, whenever you want to add one more subject, you should pick some subject which is easy and comfortable. So that is the reason why I listed out all the subjects, and I'll differentiate which subject is easy and comfortable to read when compared to other subjects. Okay, so coming to anatomy is not an easy subject. Okay, I will consider embryology and histology are easy. Okay, easy in the sense content wise they are easy. So either it should be content wise easy, or either a subject should be understanding wise it is easy. You see, oral surgery is a vast subject, but it is understanding subject. So I will consider OS as an easy subject. Reason is you read, you understand OS. Okay, so content wise it is large, but you read, you understand OS, and OS is easy to understand. OS is interesting to read from a dental student point of view. Okay, so I don't consider general anatomy as an easy subject. Okay, I don't consider biochemistry as an easy subject. Okay, I don't consider physiology as an easy subject, but I will consider dental anatomy, dental histology, and oral embryology as easy subjects content wise. Content is very small. Like you sit for 2 or 3 days, you can finish DA, and you sit for 2 or 3 days, you finish. Means in a span of 5 days, you can finish both dental anatomy, dental histology with embryology. So content wise, yes, this is again an easy subject. Embryology, general embryo is easy to finish. General history is easy to finish. DM, no. Okay, but anesthesia, content wise I'll tell it's an easy subject. Content wise I'm telling it's an easy subject. General path, content wise I'm telling it's an easy subject. Medicine is tough. Surgery is very interesting to read. Surgery, general surgery is easy subject. Oral path, oral medicine, forensic odontology are content wise the most vast subject, but understanding wise, familiarity, because as a dental student you are familiar with most of these terms, terminologies, disease, syndromes, and everything. Considering that, I'll keep this as an easy subject because you read, you understand this subject. Radio, you read, you understand, interesting subject. Pedo, preventive, read, you understand, interesting subject. I don't consider perio as an easy subject. Okay, it's an average subject, but not an easy subject to be added when you're dealing other tricky subjects. Ortho, no, never an easy subject. Yes, cons is an easy subject. You read, you understand. Endo, you read, you understand, it is easy subject. Community, no. Prosto, no. And again, I will add OS is an easy subject. LA, easy subject, easy to understand, interesting. Medical emergencies, interesting. Medical considerations, interesting. Implantology, interesting. So this is how I segregate, basing upon my experience and interaction with most of the students. So I give E tag. Okay, you can add this load. If you want, you can add this load. Okay, and whenever you're adding a load, make sure you should be very, very clear with your checklist, what you want to read, what depth you want to read, what you want to do, how many MCQs you want to solve, what are the sources you want to rely on. So this is very, very important. Whenever you're adding extra subject, the subject should be easy. Don't pick a tricky subject like, oh, pharma, medicine are going, don't add general anatomy. It's going to be so tricky. You're done with general anatomy, yes, you can add. But if you're not done with the subject, you want to add, make sure, try to add easy subjects. Those are the subjects which are going to be comfortable. So in this part, okay, I focused on segregating the things, segregating the overall number of subjects, okay, and segregating the easy subjects. Whenever you want to add a load, whenever you want to revise, try to pick an easy subject. Okay, right? So my point is TGP, that is time. First of all, fix your time. Second one is fix your goal, what you want and everything. Now, so I got a request from most of the students, but I have taken one scenario into consideration. The scenario is probably an intern or a post intern who is working in the college, post intern who is working in a clinic. Now they want to take break from the college, or their internship is done. So you see, Karnataka interns are done with internship by September. So it can be a request from a Karnataka intern who want to start the prep fresh from 1st October, or a clinician who is working in the clinic has resigned the job and want to start the prep from October 1st, or an Andhra intern who has taken a break from the college for about 2 months, okay, and want to start preparation very seriously from October 1st. So their request is, yes sir, we want to start the prep, we want to organize the things in the next 5 days, want to start the prep very seriously from October 1st till the date of exam. So now I said, like, how many hours you're going to read, because my TGP is asking the time. I got the days, now I want the time. They said like 8 hours 8 hours per day on an average. Overall 8 hours, maybe in the last couple of days they may increase to 10 plus, but that's their wish. But on an average it is 8 hours per day, the strategy. So 8 hours per day preparation is going to start from October, that is October, November, December, January, February, considering the exam will be in the month of March. So 1, 2, 3, 4, 5 months, 5 into roughly around like 30, 150 days strategy. And they are very clear, sir, we want to finish the syllabus, whatever it is, we want to finish the syllabus by December, and from January, February, whatever March, whatever is there, we'll start revising that, and along with the revision, we want to read something extra if it is required. But I want a preparation plan for these 90 days covering all the subjects, whatever you have listed out. So this is what the suggestion, this is what the inputs which are given by a group of students who want to start their preparation from the October, want to read 8 hours per day, want to finish the syllabus in 3 months, and want to use the 2.5 months extra or 3 months extra for the revision. Along with the revision, they want to do some XYZs. So now this is a basic PDF which I'll be sharing for all of you onto the group. So first, write down your name, write down your dream college, write down your dream department, your phone number, your email address, emergency, whatever it is, all your apps wala usernames and passwords and everything. Okay. And then I mean that I was talking about T, right? So I was talking about T. So your T is going to start from October 1st. Okay. So October 1st to 31st, you have 31 days here. You have 30 days here. And you have 31 days here. And followed by Jan, you have 31 days. And February, you have 28 days. And whenever we have the exam dates that are clearly mentioned, try to block those exam dates. For example, assuming that the exam will be some other day. Okay, for example, the exam is on 23rd March. So block it, the D-Day, you try to block it. And May again you will be having, May INICET will be there. So block the dates, and you keep, like, for example, now this category of students has kept the deadline as 31st December. So mark your deadlines and mark the areas where you want. For example, so I want to give one exam on a particular day. So for example, I want to give an exam here, I want to give an exam here, I want to give an exam here, I want to give an exam here. So mark those days where any live exams are there, any exams in MDS CONQUER where you want to overlap your strategies and everything, you plan accordingly in this particular calendar. Then comes the timetable. So I said, like, it's an 8 hours per day plan. So my recommendation is split those 8 hours into 4 slots, slot 1, slot 2, slot 3, slot 4. And make sure, try to stretch your slot for a longer duration of time. Means I strongly recommend you to do at least 1 3-hour slot per day considering the exam time. But even if it is okay, you can stretch 2 hours of each slot. 2 hours of each slot. And whenever you're starting your prep, for example, this category of students starting the prep from October 1st, you try to check out what is happening on your regular group. What subject it is running. Is it as a comfortable subject? Are you ready to read that subject or not? You decide. Assuming that, okay, a subject is running, which is a tricky subject. Now you try to add subjects which are easy. I listed out, right? I listed out subjects which are easy. Okay. So whenever you have 8 hours of time, okay, you split that into 4 hours, you give to the running subject of the group. If you want to follow, or if any coaching center, you want to follow the running subject because you want to attend the classes live, you're an offline student, you have to attend the classes live. That is the purpose why you have joined offline. So you cannot read a subject which is being, you cannot read any other subject rather than the subject which is being taught by your mentor. So I recommend you to go with the subject what is happening on the group. For example, you are not interested in that also. Okay. First month, for example, October 1st to October 31st, cover subjects which are easy. I listed out subjects which are easy. Okay. For example, if you ask me which subject you want to start, if you are preparing, sir, the group schedule is having pharmacology. So I have 1, 2, 3. I have 4 slots each of 2 hours, sir. Okay, I have I have four slots each of 2 hours. So first slot I'm going to give to pharmacology. Okay, I'll do something. Second slot I'm going to give to pharmacology. So now I feel like pharma is tough, so I'll give the third slot also to pharmacology. So in a day, I have the 4th slot that is being left over. So which subject, easy subject I will add is endo. If I'm not done with endo, I'll start with endo. Or for example, I don't want to follow the schedule. All the subjects and everything are available for me. So I want to start with, you can start with 2 easy subjects. 1-2 slots you can start with endo, and 1-2 slots you can start with conservative. So prepare a schedule. You want to start with the group, so you try to come out with a mixed plan. Okay, start with the group schedule, followed by give 1 slot to the extra easy subject. Or you don't want to do that, in the first month straight away go with all the easy subjects, because in the first month, whenever you're restarting the prep, whenever you want to restart the prep, reboot the prep, make sure you should gain utmost confidence in the first 15 days. So whenever you're dealing easy subjects, easy to understand, scoring subjects, you will gain that utmost confidence. Okay, I hope you are very, very clear. But once you gain confidence, 15 days done, 20 days done, your number of hours also will increase. Okay, so your number of hours may be initially 6 hours or 7 hours. Now they start moving because you gain the confidence. So basing upon that, you plan your preparation accordingly. For example, you write down when you're taking breaks, write down the overall day analysis. So this is going to give you an idea where you are wasting time and how you are effectively utilizing the time. So now you will get an idea after 10 or 14 to 15 days, you'll get an idea like this is an area where I am wasting most of my time. So you take suggestions from the mentor or you implement your strategy by which your effective time should be improved. So this analysis is very, very important. For example, if someone want to restart the prep from October 1st, I recommend them to start with endo. You can do endo 1 to 1.5 hours per day. Again, pedo or operative is going to be very easy and comfortable subject. So I start with conservative 1 to 1.5 hours per day. Third, I'll go with a regular subject which is going on the group. Let it be pharma or oral path or oral medicine or anything. Okay, so this is how my strategy will be. So I'll be doing this 2 for 3 hours because this is an 8-hour strategy. So I'll be doing pharma for 5 hours according to the schedule which is given on the group. Okay, right? I hope this is very, very clear. If it is like this, so basing upon your ideology, you can change easy subject in combination with a difficult subject, or whenever an easy subject is going on to the present group, you can go with the difficult subject from that, a combination of easy plus difficult or difficult plus easy as per your requirement. So this is very, very clear. And you prepare a strategy and try to follow that particular strategy. You require any suggestions or inputs from the mentor, you can discuss with your mentor. So mentor is going to tell you, you can add something there, you can remove something there. So mentor is going to give you any modifications that are required. The next important thing is you should be very, very clear with the checklists of all the subjects within your limitations. That's what I'm telling. Now you got your T and you got your G. So now you need to plan. Before preparing a schedule, it should be very, very clear that we should be clear about the checklists. Okay, means in this particular subject, what I need to do, what I can do, what sources I have to do. Okay, for example, now the checklist is like, for example, this particular individual is going to read endo 1.5 hours per day, and she or he is going to read this like for 10 or 2 weeks. Okay, assuming that they're going to do this for 2 weeks. Okay, 2 weeks each of 1.5 hours per day, that turns around to 20 hours of prep. So now I got a time limitation for endo. 20 hours is my time limitation in this 3 months, because I need to finish the syllabus in this 3 months. So in this 3 months, if I'm reading 90 days into 8 or 10 hours, that turns around 900 hours of preparation time. In this 900 hours, I can allocate maximum 20 to 25 hours for endo. So in 20 to 25 hours for endo, what to be done? What can I do and what sources I have done? For example, if you ask me, my recommendation is, for example, this particular students who has asked me, most of them, they belong to ProLive. So in a 20 hours checklist, what I'll ask is, I'll ask the students to start with ProLive classes, because you have already 2 ProLive classes of endo, each of 2 hours. If you want to analyze them properly, it will take 4 hours or 5 hours for each class. So you will take 4 hours for each class. So 8 hours is done. So in this 2 ProLive classes, more than 120 or 130 questions which are given in the last 5 to 8 years were discussed. So these are the star important things. Then second thing is bootcamp series video. Again, bootcamp series is 2 hours. 2 hours may take 3 hours because you're already done with ProLive 8 hours. So it will not take much time. So your bootcamp series will go a little fast. So this turns around like 3 hours. Totally it is 11 hours per done. Now I want you to focus on MCQ because you have a strong foundation with ProLive and bootcamp series. Now jump into MCQs of endo and try to solve as many MCQs as possible. That MCQs preferably should be from the Q bank. You have to do from the Q bank, or you have to do from the PYQs. Not the subject, not the topic wise MCQs of dental pulse. It is the last part of dental pulse. Okay, in endo part. That is recent MCQs 2017-18, recent MCQs 2020-21. So all those are called as PYQs. I want you to focus more on those areas because our time limitation is limited. So you need to have a smart preparation. So I want you to do QBank. I want you to do PYQs. Then after finishing this, okay, on the last day, you segregate some time. Okay, and decide that I'm going to give endo a subject exam on this particular day. You give the subject specific exam on the endo and analyze this properly so that you will get an idea over the entire subject of endo. So this is what the checklist, and these checklists are going to vary from individual to individual. It is not same for all, but this particular individual, okay, who is a ProLive student, want to start the preparation from October 1st, want to end the first reading by December 31st, and can allocate 8 to 10 hours per day. So this is what the checklist I'm going to give, because this is how you can have a smart preparation. With a smart preparation, you can get a great rank. So I want you to prepare checklists. Okay, on the day one, not for all the subjects, but at least for the subjects which you are planning to read in the first month. Then comes is, I told you, right? I'm going to fix the date. So this date, okay. So for example, I'm starting from October 1st. I decided, okay, chalo, on October 8th, I'm going to give endo exam. So endo subject specific exam, I'm going to give on October 8th. You keep the deadlines properly. Okay. By this time, I'm going to finish this exam, finish this reading. On this date, I'm going to finish the exam. Okay. So write your scores, analysis and everything, and close it. Okay, so similarly, prepare the checklist when you are going to give exam. Right? It's not about when you are going to finish reading. It's about when you are going to give the exam and when you are going to finish the syllabus of that particular subject. So this is how your GTs, mocks and everything, dates are which are announced on the group has to be marked, and by which your plan has to be executed. Similarly, I told PYQs. Okay, so all PYQs. Okay, either you want to go subject wise. Subject wise, you can read from Dental Pulse or from the website QBank, or year wise. Again, year wise are available on the website. So as of now, I recommend you to go with subject wise, because we are planning to finish the syllabus by December 31st. That is your plan. Okay, after December 31st, if you want, you can start doing the schedule of PYQ schedule. You can start doing year wise, retrograde year wise you can do. So first I'm going to do subject wise. So I'm going to keep endo, because I thought of doing endo for the first, and I'm going to do cons for the second. I decided to do pharmacology as a third subject. I decided to do pedo as a fourth subject. Now my schedule is telling to do oral path and oral medicine the next subject. So I'm going to decide when my PYQs has to be done, and this PYQs, when they're done, you keep a tick mark. 1. So 1 tick mark. 2 tick mark. 2 means I am doing the PYQ for the second time, because PYQs has to be done n number of times. 3 tick mark means I have done 3 times revision of this particular PYQ. So everything has to be segregated. Your schedule and your checklist should be there, and you should keep a tick mark, because now you are handling more number of subjects, more number of contents in a smarter way. So whenever you keep this list, okay, then it is very safe that you will never miss any important things which has to be done before the allocated time or before the deadline. I see students thought of doing this, they, because of the schedules, because of the exams, classes and everything, they miss something. They'll get to know when to be done, and they get to know when to be done, but they are not very clear. They miss some important checklist. Whenever they miss some important checklist, they are going to hurt themselves few days before exam. So things will get overlapped, confusions, lack of confidence. You enter into examination hall, you're going to spoil the known questions. Okay, right? So I want you to be very, very clear regarding this. Okay, so please do plan for PYQs also. So I have given nicely PYQs, and followed by yeah, the schedules. Okay, right? So I'm thinking of to start from October 1st. So in this October 1st, okay, so in this first 1 2 3 4 5 6 7 8 9 10. So in this 10 days, I decided to cover cons, I decided to cover endo, and I decided to cover pharmacology. So I am trying to do these 3 subjects. Okay, for the 7 days or 10 days plan, I'm doing this. Okay, right? So basing upon that, you prepare your proper schedule, what to be done, at what time it should be done, how many hours it should be done, till your December 31st plan. So plan till December 31st. According to that, if you require any sort of modifications or suggestions, any combinations, okay, regularly we ask the students to go with integrated mode of reading. Combined subjects will be there. Like for example, oral path, oral medicine are combined subjects. Okay, you see, oral path can be combined with general path. General path can be combined with general medicine. Dental materials can be combined with cons. Dental materials can be combined with prosto. Ortho in combination with pedo. Pedo in combination with prevento. Pedo in combination with endo. So you can do any sort of combination which is comfortable for you. So preparation should always be comfortable for you. You require any suggestions? Yes, you can post this PDF to me. Any modifications, I'm going to suggest you modifications which are required for us. Okay. So that is your Jan, Feb, March, and people who are preparing for May INICET, you can plan your schedule till May INICET. Anything to be added, like for example, in the middle I was telling, okay, hey, very important, last many questions are coming from antidotes. So because we have a habit of forgetting the things, so write down there. So if you write down there, you will not forget. Okay. Sir is always telling questions will be coming from general anesthesia. Write down there. General anesthesia, must to do. COVID, must to do. Mucormycosis, I don't want to miss mucormycosis, must do. PYQs, every time he's telling PYQs are important. So whatever important things, whenever we are having a class or whenever we are having an activity or whenever we are talking to each other, write down those suggestions here and keep a tick mark if it is already implemented. How to reduce the negative marking, how to effectively give your best shot in the examination. All these suggestions on a regular basis we are going to give and follow those suggestions. So this is what the one plan. Okay, October to December 31st, 90 days, each of 10 hours, 900 hours. planning to cover the entire syllabus. Okay, right? So segregate the things into a combination of an easy subject and a difficult subject and prepare your checklist. For example, for a plan pro student or for an offline student of MDS Conquer, my strong recommendation, first thing to be done perfectly is the offline question papers has to be done for about 2 to 3 times or 3 to 4 times. Pro live papers 2 to 3 times, 3 to 4 times. Then comes the next one is the boot camp series. You should not miss the boot camp series. Okay, so boot camp series videos has to be done n number of times. Okay, so in such a way you prepare a checklist. Like for example, you're already done with 60 to 70% of the syllabus. You know what is the checklist for you. Okay, so most of you are keeping, I ask you to keep your worksheets as a checklist, because whatever you don't know, whatever you want, everything you are pulling in that 100 or 200 pages of worksheets. So for a few subjects it is 200 pages, for few subjects it is 80 to 100 pages, minor subjects is 80 to 100. So everything whatever has to be done, it is already pulled in your worksheet. Your worksheet, it will be a smartest checklist. So basing upon your preference and priority. For example, again, 5 months of preparation time, sir. Every day I have only 3 hours to read. I'm a mother, I have a kids, I need to manage few things. I can accommodate only 3 hours. My recommendation is, again, don't break your heads. Focus more on PYQs. Focus more on pro. If you are a pro live student, make sure you do pro live. Okay. If you have access to boot camp, make sure you do boot camp. Okay. PYQs, pro live, boot camp will be perfect if your preparation is within the limitation of 3 to 4 hours for the next 5 months. 3 to 4 hours of prep for the next 5 months. 150 days into 4 means you overall have 600 hours of preparation time. In this 600 hours of preparation time, my recommendation is do pro live papers 2 to 3 times. Offline student, do offline papers 2 to 3 times. Followed by attend the boot camp series. The old boot camp series is already accessible to you. Okay, again I'll be taking integrated boot camp series. I'll be taking, okay, again in the last 2 to 3 months, attend my boot camp series and do as many PYQs as possible. Solve the questions, do mistakes, analyze the questions. That is what I'm telling. Like, practice PYQs, practice MCQs. Okay, so your base is going to be 3 to 4 hours of prep for the next 5 months. Okay, so I'm trying to make it as simple as possible. So my strategy is 4 hours, sir, for the next 5 months. So it is 4 hours for the next 5 months, and for example, it is 4 hours for the next 5 months. That turns around 150 into 4, 600 hours. So in this 600 hours, my strategy is, if you are a pro live student, do pro live papers. All pro live papers, you will be having 100 pro live classes. So do all 100 classes, okay, 2 to 3 times, the question papers and everything, 2 to 3 times, followed by attend the bootcamp series 2 and solve as many MCQs as possible, PYQs as well as practice MCQs, give exams, do mistakes, analyze the MCQs, practice, pro live bootcamp, practice, pro live bootcamp. This is a strategy if it is around like 600 hours of preparation time. I hope this is very, very useful. You require any sort of assistant from my side regarding the schedule modification or regarding preparing the schedule, yes, you can always ping me on my number so that we can sit, talk and plan and execute accordingly. And of course, the schedules are going to get modified. You cannot simply rely on the same schedule. Like, you thought of reading for 6 to 8 hours, but you feel like comfortable, you're increasing the time, then we can modify the schedule, and then we can modify the checklist only for few subjects, not for all subjects. Like, you're done with a subject, it's okay, more. I feel like, okay, this part I'm missing in this subject, yeah, chalo, that add-ons will be there. So that is the reason why I told you, leave 10% of your timings, so that if any modifications has to be required or has to be done, we can look into those modifications. I hope this is very, very clear. So good day, take care, see you very, very soon with one more video. Bye.